Good afternoon, everyone, and welcome to A Gathering Place. And as you know, every fourth Wednesday, we're talking public health awareness with St. James Health and Wellness. We've got a good show in front of us. We're welcoming back the clinical pharmacist, Dr. Natasha Colvin. She's got a new name. We're going to talk about that briefly, and some other guests also. And we're going to dive right into COVID updates, vaccine updates, and happenings in the community regarding public health as soon as we come back.
Hello, I'm Marilyn Hemingway, and welcome to A Gathering Place. I said, I'm stepping back because we have young voices who want to be heard, and they're moving on something.
Branding is really important to you and your business.
Even a basic type of technology, you learn it all.
And people are
Good question. Well, we're back. Let's dive right on into it, and let's go ahead and let's welcome Natasha. Natasha, I forgot. I saw your new name, so congratulations again.
Thank you. Thank you.
I'm used to that, but this is now Natasha Newman. So
Yes,
thank you.
ma'am.
Thank you for joining us. And you are the clinical pharmacist at St. James Health and Wellness. Is that correct?
Yes, ma'am. And it is. So actually on April 1st, I will have been here. Oh, could you hear me?
Yeah, you got hung up a little bit. How long, April 1st, how long will you have been at St. James?
It will be 3 years.
Really? Congratulations.
Mm-hmm.
Congratulations and happy anniversary. Let's also have coming in with us Miss Linda Lynah, who's community outreach at St. James Health and Wellness. Linda, what else do you do? So I'll make sure that we cover everything.
Well, I am also the community relations, and just recently I am also a certified navigator for the health insurance marketplace. So
very
those are
good.
3 roles.
Very good. And we'll learn more about that and the services provided by St. James in a few minutes. And of course, we have with us a community leader, activist, Miss Florinne Linen, who was recently honored for the work she has done for many years with Diabetes Core Group. Did you, Miss Linen, did you retire, or did we just celebrate you, or did we do both?
Well, I retired, but my daughter-in-law is now working in the position, and I'm just helping her out.
Very good.
Occasionally.
Very good. Well, you have earned a well-deserved rest, and I hope you enjoy your retirement. And welcome, everyone. So we've introduced everyone, and we're going to welcome Linda back again in a few minutes to give us the updates while we have a conversation with Natasha and Miss Florinne. Linda, we'll see you in a few minutes.
Okay, bye.
All right. So we thank you, Sherry Morris, for joining us today. Good to see you. And if y'all have any questions, please drop your questions in our comment box, and we will bring your question up, and hopefully we can get those answered. So we have Miss Florinne Linen with us and Natasha, and they're going to talk about COVID, and Miss Florinne's going to share her personal journey with COVID. But Natasha, let's start with you. What's going on with COVID? What's going on with COVID vaccines? And clear up some stuff for us. There's a lot of questions out there, as usual, because they're lifting a lot of restrictions and stuff. But tell us how vaccines and things are impacting that.
Okay, yeah, I think last time I was on here was actually back in July of last year, so a lot has changed since then. So we currently, still have the 3 vaccines out, the Pfizer, Moderna, and the Johnson & Johnson, but they're, leaning more so towards the Pfizer and Moderna now, just because of the adverse effects that was associated with the Johnson & Johnson vaccine, and that being the, the pulmonary embolisms and things of that nature. So obviously we know that the Pfizer and the Moderna are the ones that are considered the mRNA vaccines, and they are or consist of 2 doses. The Pfizer one is given 21 days apart, and then the Moderna is given 28 days apart. And then also since then, as I guess treatment, I know the vaccines are considered prevention, but for treatment, we now do have the new Paxlovid, which is an antiviral, which consists of 2 antiviral medications. I'm not even going to try to butcher the names, but it is a course of antiviral therapy for patients who are considered to have mild to moderate disease, and it is a 5-day course that is by prescription only. So if a patient comes down with COVID and they're considered mild to moderate, not in the hospital or anything like that at the moment, then and the prescriber could see that they have the potential of progressing to severe disease or hospitalization or something more severe as potentially dying, then that is a course of therapy that would be recommended for that patient. So it's 3 tablets that you would take twice a day for 5 days. So that's a total of 30 tablets that you would be taking over a 5-day course, which is a lot of medication, but risk versus benefit, it is beneficial. Also, I guess now we know that the vaccines have the age limit has lowered now down to 5 years and older can receive the COVID vaccine. And I know there's, I guess, it's in the pipeline that they're looking all the way down to 6 months. So I'm not exactly sure when that's going to get the approval, but at some point in time, probably in the near future, it will be approved for 6 months and older. Um, Again, we know as far as variants out, or hot variant at this moment. So people have a lot of questions about, why so many variants keep coming out. And that's where the vaccines are the most important thing. We're trying to, keep encouraging everyone to stay up to date on their vaccinations, get the vaccination or stay up to date on the boosters, because the more that these viruses and the variants spread, the more likely they are to mutate and create more variants. So, vaccination is one of the best preventative measures that we have at this current moment. Again, I still personally recommend, wearing your mask. Even though I've seen, I think, an article today that says all except for one state, which is Hawaii, has started the mask mandates. So, but I mean, it's always your personal opinion. So wear your mask, wash your hands. If you have to cough, cough in your elbow if possible. And then socially distancing at least at 6 feet. As far as data that I've seen about the Omicron in relation to the Delta, it spreads more easily. So that's why we're seeing, had seen an uptick in the amount of infections across the country. But it is considered to be less severe than the Delta. So it's not requiring, as many hospitalizations or things like that of that nature. The symptoms of the Omicron are pretty much the same. We know that the list of COVID symptoms has grown significantly. It's like everything is associated with COVID now. So, but usually we think of, sore throat, cough, fever, fatigue, body aches, chills, loss of taste or smell, some maybe nausea, vomiting, things of that nature. But like I said, that list is not all inclusive at all. So it could be a whole host of different things. And I know Ms. Linen is going to share her story, but I unfortunately had COVID last month. So
Oh
one of my
no.
first symptoms, I know it was bad. It was definitely bad. And that was my first time getting COVID since this whole pandemic was going on. And I have seen studies that say, you can get Omicron, like they're saying people get Omicron more than once. But I know in general you can get COVID more than once. And my first symptom was the sore throat. Um, I didn't know, Miss Lynn, if you wanted to chime in about some of your experience now, or if you
Yeah.
wanted to wait.
Miss Lenny, share with us your personal journey. This is why it's important that people need to get the vaccine, because not only are you protecting yourself, you're protecting others. And Miss Florine went through a journey with her COVID. We'd love to hear from you, Miss Florine, about your journey.
Well, thank you very much. Can you hear me?
Yes, ma'am.
Can y'all hear me?
Yes, ma'am.
Okay. Yeah, it was a trying and a scary time with me. I went to the doctor, and the doctor said to me, "Is like, oh, you getting over this COVID? You're getting over it. You all right?" But I wasn't all right. I came home and started coughing all over again, and I went to bed this particular night, and my grandson said he heard me in the room talking, and my head was just hallucinating. I was talking to my husband who had just died. I was talking to my mom who been dead, and the pain and the not even like myself. I did not wish this on nobody. It seemed like an elephant step on you or something. It was one of the most horriblest thing that I've ever had to contact with. And that's why I am out here now. I'm working with the group out of MUSC, trying to deal with the COVID. I'm working with Ms. Liner and them trying to deal with the COVID because you're out of your mind. You're out of your mind. My son came in the room and he says, "Mom, what's the matter?" And I couldn't even say. I said nothing. He said, "Well, who am I?" And I said, "Herbert." And the day Herbert died a year or so ago. And then my daughter came in and she says, "Mom, who am I?" I said, "My mama. My mama died 16 or 17 years ago." It was just a thing I wouldn't want on my worst enemy because you don't know what to do and you don't know how to even explain it. But I was one of the lucky ones. Hallelujah. I went to the hospital. They called EMS. And EMS took me to the hospital. They're saying her age is right for this infusion. She has many diseases that will help protect her with this. And they said this infusion that we're talking about is infusion that President Trump took. And at that time, I was like, I don't care who take it, give me the infusion. And I began, after the infusion, I can't remember the hours it was, but I can tell you I felt a lot better. And I came home, they didn't keep me because they said, we have more sicker people. So I came home, and all that week, I was just weak, weak. I couldn't think. I was talking to a friend yesterday who told me about another friend who seems to be losing it. And I said, you know what? That COVID does that to you. It makes you just lose it. And if you're not a strong person, you don't never and have a connection with Jesus Christ himself, I doubt if I would have pulled through because I have many other issues. But because I was strong and because I knew a little about COVID, because I'm a community person, so I try to learn all that I can, it helped me to pull over and to pull through. But I had many friends, 1, 2, or 3 of my best friends, they crossed over because of COVID. But some people, now let me say this, I don't know if I can or not, Miss Marilyn. Can I?
Go ahead, say what you want to say.
Some people believe that it's not going to hit me. I'm not going to take it, I'm just not going to take it. It's not going to get me. God is going to protect me, yes. But he also gave us sense to protect ourselves.
Mm-hmm.
And if we sit around and play with this COVID,
That's right, Miss Florinne. I think you're getting hung up a little bit, but what you were saying is, I think God has given us the brains and the gift to come up with solutions to our problems. And
right.
we don't want anyone else to get sick. And this is why we encourage people to take the vaccine, to wear the mask, to cough in
That's
the
right.
elbow, I guess I shouldn't have covered my mouth to demonstrate that at that point.
Yeah,
But
but that's true. Because on my door, we have 3 doors here. On my door, my daughter got no mask, no come in. And that goes for all of my grandkids. And I got a whole bunch of great grands and grands. If you don't have on your mask, you don't take no chances when it comes to COVID. You
that's
make
right.
sure your mask is on. You make sure that you wash your hands. You make sure that you cough, like you said before, in your arm. And you make sure that you stay that distant. I must say this too. So many times I've come across people that says, "Are you in church?" Yes. Well, I'm not going to church because I'm worried about the COVID. Well, you're in Walmart, and Walmart is full of people, and where there's a crowd of people, 2 out of 3, somebody didn't wear their mask.
That's right.
Somebody didn't protect themselves from COVID.
Mm-hmm.
So you need to protect yourself, young man, young woman, old man, old woman, everybody, babies, protect yourself from COVID because you do not want to go through COVID. It ain't nothing to play with.
So, Miss Florinne, let me ask you this: do you have any lingering issues? There's the situations with long-term COVID. People are still, even a year after having the initial COVID, are still feeling the effects of it. Are you still feeling long-term effects?
No, ma'am, I've been blessed. I do not feel. Someone asked me that the other day. Did I feel anything from it? I says no, because before COVID got me, I had back problems,
Mm-hmm.
and I'm still having back problems. And I had my kidney removed with cancer in September,
Mm-hmm.
but it wasn't due to no COVID. So I'm quite blessed.
Yes, you are.
Yes.
Especially if you had a kidney removed because of cancer, and that's an underlying condition. So
Yeah.
to
Oh
have you with
yes.
us, it's a blessing for all of us that you're here and you're able to continue to share your story. Natasha, how important is it that we achieve herd immunity to continue protecting, hopefully, folks like Miss Florine, because she has an underlying condition. She's
Right.
recovering from cancer. And where are we regarding herd immunity? Do you know?
I don't know the exact number, but I know, like at St. James, we are thankfully still seeing some trickles of first doses that we are still given. So, I mean, I know it's 2022 now. We've been in this going on like 2 years now. But thankfully, some people are still, changing their minds and deciding to get the vaccine. And I don't know if it's because of, personal preference of wanting to get it now, but then I've also noticed that a lot of employers are, is mandating it. So it's kind of pushing people more towards that line of becoming vaccinated. So, the more we can get vaccinated, the better and closer we are to obtaining that herd immunity. And, I just like to recommend it as much as possible. And I did want to, make note that you aren't considered fully vaccinated until 2 weeks after that second dose of the Pfizer or the Moderna. So
Mm-hmm.
we just want to make sure that, people are not just letting all safeguards go after, like, same day after they get the first shot or the second shot. Like, you have to wait that 2 weeks after that second dose for the Pfizer or Moderna.
Yeah. Well, I'm boosted. I went ahead and got boosted. Miss Florine, are you boosted also?
Oh yes. Oh yes.
Yeah, yeah. And I
Oh
know,
yes.
and I still wear my mask,
Mm-hmm.
practice social distancing. I do eat out, but it's still, like you said, Miss Flynn, wash those hands, social distance,
Right.
take those precautions for yourself and
That's
for
right.
others. Even though the states are moving to to remove all these restrictions, COVID is not going anyplace. It's not
No.
gone, folks. Scientifically, we have to achieve that herd immunity. and
That's
just
right.
go ahead and get vaccinated. And I hear, Natasha, you've mentioned like personal preference and everything. I read a recent article about the importance of public health and
Mm-hmm.
how we moved away from public health back in the 50s and 60s, and it was tied into like military, or something happened and we all,
Right.
would go get your vaccination, go wear a mask. I remember as a child going through school, you got vaccinated to go to school. And so
Yes.
the article was about how we've moved away from an understanding of public health, and it's become very individualistic. What I want for me, what I want for my family. But the result of that is it leaves us as a society very vulnerable to COVID. And there are
Mm-hmm.
going to be more COVIDs, but if we as a society understand the importance of public health, then that impacts us as individuals.
Right.
Yeah, and
And I
that's what.
did want.
Go ahead, Natasha.
Oh, I was gonna like piggyback onto what you're saying too. Like I know it's considered like personal preference, but it's a lot of political statements that's going on too, where people think it's like something political that's going on trying to push the vaccine.
Yes.
And then us as an African American community, we know from previous things that have happened, it puts us like on the edge of not wanting to trust the government pushing out vaccines and things like or injections into the body. So it's leaving a lot of people hesitant on like what's going on with this vaccine. Like why are they trying to mandate it for everyone? Like is a way of trying to control the population. Like I've heard multiple things, which like leads me to some of the questions that I was going to talk about today too, about the misconceptions related
Yes,
to the
please do.
vaccine.
Let's get into that since you brought it up. The misconceptions, because you just made some very good um examples. But I want to note first, this is why it's important that Natasha comes on these type of shows, and a Miss Florinne Linen, because Miss Florinne did not only just have a personal experience with COVID, but because of the work she has done in the community, especially with diabetes core group, she understands the importance of education and public health awareness. That's what
Yes.
it is. It's knowledge. And she's been doing it for years, folks, because she understands that we are all in this basket together.
Mhm.
Together. That's right.
And we know one thing: COVID doesn't care about race, it doesn't care about gender, it doesn't
Nope.
care about age. It just knows that I want to invade this space, and
That's
I'm
right.
going to find any weakness to invade that space.
Yes.
But because there are misconceptions, we actually are opening those cracks wider and wider for COVID to get into. So let's address some of those misconceptions, Natasha and Miss Florine. Feel free from your experience to hop
Oh
in
yeah.
and give your opinion. But Natasha, what are some of the misconceptions that we could dispel this afternoon?
I know one of the main ones, like I was saying, just the political thing. So people are thinking, maybe this vaccine is altering something in the body, like your DNA. But that is, false. These vaccines are not made to alter anyone's DNA. And then I know I've spoken with you about this before too, in regards to people thinking, like the flu shot. If you get the flu shot, you get the symptoms of the flu. But these vaccines, any vaccine, is made to teach your immune system how to react to the virus or whatever it is once you come in contact with it. So these mRNA vaccines, the Pfizer and Moderna, were developed to, teach your body how to make spike protein, which is a harmless piece of protein that's found on your, or can be put on the cells through the vaccine to teach your immune system how to react if it ever came into contact with COVID. So basically, the vaccine dresses up like cells in your body, like burglars, I would say. So that way, if COVID, which is a burglar, would come into your body, it knows, we need to fight this thing off. So it's just a way of protecting yourself. And anytime you're teaching your body to develop an immune response, you do develop those side effects. And those side effects include like the fever, fatigue, and stuff like that. So some people, after they get their first or second vaccine, they say they feel, down in the funk, just because it's just your body's natural process of, developing that immunity and antibodies to the COVID virus.
You're
Yeah.
so
Go ahead, Miss Florine.
Yeah, I started saying, you're so right. I was talking the other day to a grandmother, and she told me that she says, I got after my grandsons about not taking the shot. And she says, Miss Lennon, you know what they said to me? I'm not going to take it because that is something to prohibit your manhood. She says, I looked at him and she says, I got tickled. Your manhood, y'all ain't got no manhood. Y'all have babies and y'all don't have to take care of them. Y'all ain't got no manhood. You better go take that shot. And that's the concept of so many of people. It's gonna do something to me. It's gonna kill me. It's gonna stop me from bearing children. It's gonna change my DNA. It's gonna change my future. Look at me. I took all three. And I says, if they got another one, I'll take that too. Because nobody wants COVID. I go to church and I don't go in the grocery store. My children do that. I go to church and I go to the doctor's office and I have a mask and I keep it on until I get back in my house. It ain't no joke. And until it hits your family or hits you, then these people that's running around and saying all this other mess, they'll see the difference because it's nothing to play with. And we are out here trying to tell them what is good for them with it.
And I have to say, the grandmother of those boys, no one could say it like a grandmother.
That's
Grandmamas just tell you, and I hope they listen to her. I remember at the Georgetown NAACP, we were doing work getting people to the vaccinations and stuff, and we were out someplace in the community, and there was a barbecue going on, and there were some young men standing there, and they were telling us they weren't going to get the vaccine because they were going to put the microchip, thank you,
Exactly.
in their bodies, and they didn't want the government tracking them as they were holding the cell phone in their hand. Not real. If the government wanted to track you, that cell phone that you hold in your hand,
that's right.
It's already
doing it.
Already doing it. And it's just hearing these rumors, but unfortunately, these myths and rumors, people are dying from this.
They do.
They're dying. You're dying from it. Plus, we still don't know the impact of COVID. It may be COVID that is preventing you from having children, because there's a lot going on with your internal organs from COVID. So we need to get better knowledge. But this is why we're having these type of shows. Natasha, what couple of other misconceptions that you can?
I'm glad you pointed out the microchipping, because that was one of them too. Like you said, these vaccines are not tracking devices or anything to be implanted or microchipped into the body. First of all, the vaccine has to go through a needle. The end of a needle is like very, very tiny. It's definitely too small for any type of tracking device to be put into it. Like you said, the cell phones obviously have tracking devices in it. If the government wants to follow you, they're already following you with your phone if you keep it on you 24/7. Another thing is that the vaccine prevents you from getting COVID. I'm sure we've all realized that that's, vaccines are a preventative measure, but they're not 100%. Like, you're just not, can just disappear from COVID once you get the vaccine. So there are things, they call them breakthrough infections. So even like myself, I'm vaccinated and I got COVID. So it's, doesn't make you invincible or anything like that from getting the virus, but it is our, sole way of trying to control this. So that way, hopefully at some point we can get out of this pandemic or endemic, whatever they want to call it nowadays. So we all have to do our parts and try to help, like Miss Marilyn said, accomplish herd immunity.
And that's the thing about vaccines and even other diseases such as like measles. Measles is not gone, but we have it under control.
Mm-hmm.
Because of vaccines, we've achieved herd immunity. But if we decided that we're not going to take the vaccines against measles anymore, it has a chance to break through. And probably even more alarmingly, it has a chance to create a variant. And then it's almost like starting all over again. So with Omicron, so with COVID, because we have achieved herd immunity, it's going to keep creating variants because it's always going to try to find those cracks to get into our system.
Mm-hmm.
And it just adjusts. The virus is going to adjust because the virus isn't worried about the myths and the disinformation. Right. The virus just wants to invade.
Exactly.
You might
and it's going to do that. And it's up to us to listen to folks like Miss Florinne, who has personal experience, unfortunately, with COVID, but also you have public health experience. And Natasha, who's a clinical pharmacist, who knows what she's doing. And to be quite honest, we need to see more Black people in your positions.
Yes.
In your professional positions. That's one thing also that I actually read and understand. More young Black people, more young African Americans are actually applying for medical school because of COVID, because they want to be part of the solution rather than part of the problem. And that would help. I understand having more trust in people who look like you.
Right.
But you still, I go to the doctor and I had a Black female OBGYN, and I'm looking for a new one because she left. But my primary care physician, there are not a lot of Black primary care physicians around here. I grew up, fortunately, with a Black doctor, Dr. Beck. I know you remember him, Miss Florinne.
Yes.
He was my next door neighbor. He would come across. Yes. He would come across the yard and give us penicillin shots for everything. And we would run and hide under the bed. But anyway, but now my primary care doctor is a white male, and we had to kind of make some adjustments. I had to advocate for myself, but that doesn't mean I'm going to stop going to the doctor because I can't find someone.
If you remember, Miss Marilyn, you probably were too young, but older people remember that the polio came through.
Hey,
and
Miss Marilyn,
we had to take vaccinations and stuff for that. And a lot of people said a lot of stuff about the polio. But during the times, your parents would have you line up, because my dad had 10 children, line up, and we are going to the health department, and we are going to take the polio shot. Because it's preventing you from getting polio.
That's right. That's right. And I came along the tail end of polio. There were still people in the iron lungs and stuff, but my childhood, it was disappearing because of the vaccine. And to go to school, we had to get all those shots, and I still got my mark on my arm.
That's right.
I don't know if y'all have it. I don't know if you have it, Natasha. You're younger than me and Miss Florinne. But it's the shot, and I still have that mark on my arm. They lined us up at school. You couldn't attend school if you didn't get those shots.
That's right.
Yeah.
That's right.
So, and now we don't have to deal with polio, but I think we have first world problems in that we take for granted the work that it took, not only from our scientists and doctors and pharmacists, etc., but the work it took from us as the public to achieve herd immunity.
That's right.
To get rid of polio, to get rid of smallpox, measles, and stuff.
Right.
We have that. It's a distant memory, but it's impacting us now with COVID. And I know we got to wrap this up and everything, but one thing I do want to say, Miss Florinne and Natasha, I am appreciative of wearing the mask also, because I have not had a cold in 2 years.
All right.
Not the flu, and that's a side benefit of the most unfortunate circumstances, but it goes to show we should be wearing masks anyway. I wore a mask when my niece got married 6 or 7 years ago in Arizona. It was just, I said, I'm going to wear a mask on the plane because I didn't want to catch a cold from somebody and then just be miserable at the wedding.
Right.
So I wore a mask, not really kind of thinking about it. I knew it would help me, but look, y'all, evidence. We need to be wearing masks a lot. and washing our hands and
Yes.
coughing in our elbows, and we take it for granted.
Yes.
But I haven't been. I may have had a little
Right.
sniffle.
Probably
Thank
seasonal
goodness. But
allergies.
then I go take my little immune thing or drink some hot tea, knock it right on out. But
Right.
I have not had a cold in 2 years.
Wonderful.
That is wonderful, and it's
It
very
is.
fortunate and a blessing.
Wonderful.
Natasha, and Miss Florine, before we leave, before you have to leave us, any last words from you regarding your personal journey with COVID?
I would just like to say to everyone to be careful, to protect yourself, and by protecting yourself from COVID, you're protecting others. Don't buy into this thing that, oh, I'm not going to wear no mask and all this stuff. Don't buy into that, because you might be one of the ones that'll be sorry. And take your shots. I've taken all of mine, and I took mine gladly.
Mm-hmm.
And I'll take any more else they come out with, because I've walked the I've walked the road of COVID,
Mm-hmm.
and I know what that road can dish out to you.
That's right. That's right.
You just
Yeah.
don't have it. People, you can talk about it, but nobody can really explain it like someone that walked that way. And I was blessed because many of my friends, about 3 of them, went on. But I'm still here, and I'm still talking every opportunity I get in the church, in the highway, when I get out there to my parents or my sisters or somebody house. I tell them about COVID. All my nieces and nephews, my grandkids, my kids. What y'all doing out there without that? Well, Grandma, we'll stay on the porch. Okay, stay on the porch.
That's right.
You can't come in
That's
here
right.
without your mask.
That's
You
right.
know? And my journey is to everybody: take care of yourself. Do the very best you can. And you can put on a mask. You can wash your hands. You can cough in your shoulder. You can stay 6 feet back. I don't care if you're in the drugstore getting your medication. 6 feet back. Wherever. Protect yourself. And by protecting yourself, you'll protect others. And I'd like to thank you, Ms. Marilyn and Ms. Lynah, for having me on, because as you see, I'm a great talker. I love to talk.
But you got a lot to share too, a lot of wisdom.
And that's why my kids say, Ma, you don't need to go back to diabetes core group. I'm going back. I'm not going to be out there like I've been before, because there's too many people still suffering.
That's right.
From diabetes.
That's right. That's
and
right.
I thank you all.
Thank you, Ms. Florine, for joining us today. You know I'm always delighted to have you on, and you're welcome. You're welcome back anytime at all. I know you got to go and enjoy those grandchildren and great-grands, but you know you're welcome back anytime.
Well, thank you so much.
All right. Good to see you. We'll see you later.
And I'm going to stick around for the program, for the end of the program.
Okay. You can listen. You'll be in the back, so I know you'll be listening and everything.
Yes, ma'am.
All right.
Good night, everybody.
So, Natasha, I want to put this up. That Companions Plus, that would probably make you sick if it has something foreign like a chip. That's true. If a chip came through a needle into your body, y'all, that chip would not be clean. You would know.
Your body would consider it foreign, just like anything else.
And would try to reject it. So thank you, Companion Plus, for noting that also. Natasha, what are some last things that we need to know as you prepare to leave us also?
I think one of the last misconceptions too is just everybody was thinking that the vaccine was rushed. But the technology behind the mRNA vaccine is new, but the research and development has been going on for decades. Like, it's been used in numerous other vaccines that we've had come out as well. So people were just thinking, it was like, oh, people are signing up to be guinea pigs for this vaccine and things like that. But like I said, the development and research has been ongoing for decades before 2020. 2019. Then, so, people were willing, to help fight off this infectious disease. So obviously they weren't guinea pigs. They just know that this information was available, and they were willing to help the society as a whole. So, we have to start somewhere. And I just wouldn't want anybody to consider people being guinea pigs for willing to get the vaccine when we're trying to help, the world as a whole. And then the last thing is, I've heard people say, like, I'm not taking it because I don't know what's in it. It's like, do you know how many things that you use on a daily basis that you obviously don't know every single ingredient that's in it?
Child, I just came from KFC and I still don't know them secret ingredients in that original chicken. And we go eat KFC chicken. So, I mean, I get you on that. We think about, yeah. I don't eat McDonald's anymore, though. But but you are so right. I just recently had a conversation with someone about that. Oh, I don't know what's in the vaccine. And the one that you said that they just developed that and people are guinea pigs. Not the underlying science has been going on for decades, because we're always this is COVID-19 because it exploded across the world in 2019. But COVID, the common cold is COVID. It's just there are different types of COVID that manifest differently. That's why the science has to be constantly working in anticipation of the next COVID. That's why every year we get a new flu vaccine, because the science adjusts to the flu. But they're the underlying foundation of vaccines that has not changed. It's exactly. Science and medicine at work. And I reiterate what you said, Natasha, because it's just so important. It's just so important that we understand this. I mean, I have to admit, I love having you guys on the show and educating me, giving me more knowledge, and just consistently repeating this stuff, that hopefully more people will realize what we need to do. Because it's quite frankly, it's frustrating to me.
It is.
It's frustrating that people, I just think people are just selfish by not doing, this could have been ended a long time
ago. Definitely a long time ago. So
I actually had at the very beginning of COVID, Dr. Thaddeus John Bell. That's how I got a gathering place rolling. And it was always had the thought, I'm going to make this a podcast. But when COVID hit, I'm like, people are out here with all this misinformation. Let me get rolling on Facebook. So this is how it really started. And we're going to do it in a podcast format. But this is how it got started. So we're continuing this. And we just got on and started talking. But I also had an MIT physicist on who's part of endcoronavirus.org, I believe. And he was saying, if we had simply shut down for 6 weeks, it would have been a done deal. Shut everything down, pay people to stay home, which some countries did. But the issue was some countries didn't either. It's like it was hit and miss, and there wasn't any consistency on shutdowns, wearing a mask, not wearing a mask. It had to be learning, there were some changes in the science, because that's what science does. It takes the facts, it does the research, then it makes an informed decision on what's going to work, or hopefully work. Because you're right, nothing's 100%. But he was saying, if we had simply shut down for 6 weeks, and we still had time at that point, because it was still early in this, he said, if we shut down for 6 weeks right now, just everybody stay home. Just stay home. Shut everything down. Get your food, whatever. Get the systems in place. We could stop it. We could literally end this. It would be basically shrunk where it was under control, which basically means it'll disappear, and we could go on with life. Right?
Exactly.
But that didn't happen. And no one really talks about that we didn't do what we were supposed to do as a society. And it's now we have these variants, now we have these political issues, and it could have been stopped.
Yeah. And it's sad and unfortunate, but we got to still try, and do what we have
still
to do.
Try.
Encourage.
As Miss Florinne says, wear your mask. You do what y'all need to do to be the part of keeping this thing shut down and everything. And go to St. James Health and Wellness, make an appointment, get vaccinated. Get your mask or whatever. Quick question before we let you go. the at-home test. Any information regarding at-home tests? I actually have my. You go ahead and tell. I'm gonna just go
Okay.
grab my bag.
Yeah, so most people may have known that you can get the four, let's say it four, the first, so I got five. I know it's supposed to be four. I don't know if they just mistakenly gave me an extra one, but you can get 4 free tests per household by going to covidtest.gov. And I think you can also sign up on like the USPS website where all you have to do is just enter in your information and they'll mail them out within 5 to 7 days. And I did get mine in a package like that. So, but yeah, somehow I ended up
I'm
getting
just
5.
opening mine.
And they only allow, 4 per household. So everybody in the same household can't, get 4 tests. But, it starts somewhere. So that way, if anyone, suspects that they have COVID, then at least you have a test readily available to, be able to see whether you're positive or negative. So I do encourage everyone to get those free tests.
So if you suspect you have COVID, is this when you take the at-home test, or do you recommend, or like say I had to go to a funeral. I actually have a funeral coming up because I've lost 2 family members this week. Would you recommend after the funeral, even though I don't think maybe I got exposed, that I should take a test? Is that,
I
not
know a
displaying
lot of
symptoms, but maybe take a test?
So it's been said that, the rapid tests, which are like the ones for the at home, are supposed to be used for symptomatic patients. So if you have symptoms, usually like 2 days after symptom onset, 2 to 3 days after symptom onset is when you would use that rapid test where you get results back within less than an hour. However, if you're trying to, be preventative or are asymptomatic, not having any symptoms, then we would recommend the PCR test, which is the one where you have to wait, 1 to 2 days to get those results back, just because of the sensitivity on the 2 tests. So the PCR is the more sensitive one, the one that takes 1 to 2 days. So if you're asymptomatic or, just trying to show proof of a negative test, if you have to go to an event or something like that, that's the more appropriate one. The rapid test is for symptomatic patients.
Okay. I'm glad I asked that question. Thanks. Learning
Mm-hmm.
something, learn that. And once again, how good are these for? Is there an expiration date? And you can
Yeah,
answer that in general.
My apologies. I haven't looked at mine in particular, but there should be an expiration date on it. I do know that we received some at St. James, and they were set to expire on next year. It was like around March or so of 2023. So there should be an expiration date on the package of those.
I'm looking, and let me see. I got an issue date. All right. Well, the answer is look for your expiration date. Yeah, look for it. So
Exactly.
I'll spend more time, and I haven't even opened the box yet because I haven't been. I wanted to go ahead and get the test so I can just be prepared.
Right, just in case.
And they were free, y'all. They're free.
Exactly.
I like free stuff so much. I went and got my COVID test just to have my free stuff. I got for
Exactly.
free. I heard free. All right.
Mm-hmm.
I like free. And then how about the mask? I heard that the pharmacies, does that include St. James, that we can go get some masks, the N95?
Right, that is something. So I've ordered them. I'm personally the ones that's in charge of ordering those, and it just opened up for us this week. So I'm not exactly sure when we're going to get our mask in. So we don't have any to distribute to the community as of right now. But hopefully in the next week or two, we will have those N95 masks. But like you said, I've heard of multiple pharmacies, having those masks to offer to the community. So if that's somewhere that you would like to go and check out and obtain 1, 2, or 3
All right.
of those for your protection and added benefit.
Very good. So once you get those in and you guys set up your process, please send word. We're here every 4th Wednesday on Public Health Awareness. Please come on in and let us know about that process for St. James Health and Wellness so we can let the public know. But yeah, I'm looking forward to that also because I think I didn't get quite the KN95s, the medical versions, but they were Food Line were carrying some for a while. And I feel that they did the job. They weren't medical grade, but they did the job. And I like those. I just felt more
Right.
comfortable, more protected with the N95.
Yeah,
So
they are
very
definitely
good.
more comfortable than the regular surgical mask.
Yeah. Yeah. So very good, very good. Natasha, it's always been wonderful to have you on. I'm going to go ahead and bring Linda in, and but anything else, Natasha, before we say goodnight to you?
No, ma'am, but thank you all for having me again today. I enjoyed it as usual.
Thank you. We enjoyed you and good
Yeah,
information. I'm glad we got
good.
into the free at home test and the misconceptions and the mask because great update. We really needed to know that information. So thank you very much for joining us
You're
today.
welcome. And good
All right, you
night.
have a good one.
Good night.
Linda, good to see you.
Yes.
Thank you. And welcome back, Linda, joining us to update us on the open enrollment, special enrollment period.
Right.
There's a difference. And let's start with that. Tell me about special enrollment.
Okay. Basically, special enrollment is a period once the open enrollment ends, and open enrollment ended on January 15th. So at this point in time, in order to be able to go into the marketplace, you would need to enroll into a special enrollment period. And there are certain requirements that you must have in order to be able to qualify for a special enrollment. And it is done through the health insurance marketplace in these situations. One of the things that the state has done this year is to make sure that navigators, which myself is as a navigator, is available to assist an individual that needs to have a special enrollment, or they have questions, or they have issues, as well as we are also here to help those persons who need to apply for Medicaid, as well as CHIP, which is a form of Medicaid at a higher level. Um, some of the ways in which you would be considered is if you lost your qualifying health coverage, and it's you or anyone in your household lost qualified health coverage or minimum essential coverage. And some of examples of qualifying coverage include coverage through a job or through another person's job. This also applies if you're now eligible for help paying for marketplace coverage because your employer stopped offering coverage, or the coverage is no longer considered qualifying coverage and you're allowed to end employer coverage. The other thing is that Medicaid, or Children's Health Insurance Program, which is CHIP coverage, including pregnancy related coverage and medically needed coverage. And then also Medicare and individual health coverage that ended after a decrease in household income that makes someone newly eligible for savings on a marketplace plan. Individual or group health plan coverage that ends during the year, or coverage under your parents' health plan if you're on it. And if you turn 26 and lose coverage, you can qualify for this special enrollment period. The other way in which you qualify for the special enrollment is if there is a change in household size. And if you or anyone in the household got married, had a baby, adopted a child, or placed a child for foster care, gained or became a dependent due to a child support or other court order, then you are eligible. And also, if you gain or become a dependent due to marriage, one spouse must have also had qualifying health coverage for 1 or more days in the 60-day prior to the marriage. This doesn't apply if the spouse was living in a foreign country or a U.S. territory for 1 or more days in the 60 days prior to marriage, is a member of a federally recognized tribe or a shareholder in an Alaska Native corporation, or lived for 1 or more days during the 60 days before their move or during their most recent enrollment period in service areas where they couldn't get qualified health coverage through the marketplace.
Mm-hmm.
And
So, oh, go ahead.
if with special enrollment confirmation, if you're enrolling in marketplace coverage for the first time, you may need to submit documents to prove you qualify for a special enrollment period due to a marriage or due to an adoption, foster care placement, or child support or other court order. The other thing that you can go into the marketplace and do the special enrollment is if you have a change in your primary place of living. You or anyone in your household had a change in your primary place of living and gained access to new marketplace health plans, household moves that qualify you for a special enrollment period includes moving to a new home in a new zip code or county, moving to the U.S. from a foreign county or U.S. territory, if you're moving from the place you attend school, moving to and from place of your seasonal employment, or moving from or to a shelter or other transitional housing. If you meet one of those criteria, then you could also qualify for special enrollment. The other means by which you can qualify is that you change in eligibility for marketplace coverage or help paying for coverage. And it says you or anyone in your household are enrolled in marketplace coverage and report a change that makes you newly eligible for help paying for coverage or newly ineligible for help paying for coverage, eligible for a different amount of help paying for out-of-pocket costs like co-payments. And what they're referring to is that they look at your income to determine whether you're, first of all, eligible to go into the marketplace and get the assistance that they provide. And it starts at 100% and it goes up to 250%. So those are the things that they are referring to. And then that way, if you are eligible, then you can go into the marketplace and you may be eligible for assistance. Enrollment or plan error, and that's where we're enrolled in a plan or we're enrolled in the wrong plan because of misinformation, misrepresentation, misconduct, or inaction of someone working in an official capacity to help you enroll, like an insurance company, navigator, certified application counselor, agent, or broker. A technical error or other marketplace related enrollment delay, wrong plan data like benefit or cost sharing information displayed on healthcare.gov at the time that you choose your health plan, and can prove your marketplace plan violated a material provision of its contract. And other situations is that if you applied through the marketplace for Medicaid or the Children's Health Insurance Program coverage during open enrollment or after a qualifying event, and your state Medicaid or CHIP agency determined you or anyone in your household weren't eligible after open enrollment ended, or more than 60 days had passed since your qualifying event, are a victim of domestic abuse or spousal abandonment, and want to enroll yourself and any dependents in a health plan separate from your abuser or abandoner, submit documents requested by the marketplace to confirm your eligibility, but your coverage had already ended, and you are under 100% of the federal poverty level, submitted documents to prove that you have an eligible immigration status and didn't enroll in coverage while you waited for your documents to be reviewed, or you are a American Corps service member starting or ending AmeriCorps service.
AmeriCorps, yeah. I did that, by the way. Go ahead.
Yeah, so that's one of the reasons. And then also can show you had an exceptional circumstance that kept you from enrolling in coverage, like being incapacitated, that kept you from enrolling, or being a victim of a natural disaster, or being impacted by another type of national or local emergency or disaster during an open enrollment period or other special enrollment period, have a newly gained access to an individual coverage, health reimbursement account, or are being provided a qualified small employer health reimbursement arrangement. And these are some of the qualifications. And the question is asked is, what if I think I qualify for a special enrollment period? If you do, you can contact me, Linda Lynah. I'm a navigator at 843-826-3773. And we also have navigators located throughout the state of South Carolina. And you can contact one of them, and they would be able to guide you as to which way you would need to go in order to apply. And then, of course, you can go on the Marketplace call center at 1-800-318-25962 to enroll. And as far as what Marketplace needs documents to confirm your special enrollment, it says that after you submit your application for new Marketplace enrollment, you may be asked to send documents to confirm the events that make you eligible for a special enrollment period. You'll get this request on your eligibility results screen and in a notice you can download to get in the mail. And it's best to pick a plan first. Then before you can start using your coverage, you must either upload your documents online or mail copies. Don't send originals. And after you pick a plan, you have 30 days to send acceptable documents. Your coverage starts date is based on when you picked a plan, but you can use your coverage until your documents confirm your eligibility for a special enrollment period. Then make your first premium payment. If your eligibility results don't say you need to provide documents, you don't have to. Simply pick a plan and enroll. For more information, you can visit healthcare.gov/coverage-outside-open enrollment/confirmation special enrollment period. But like I said, it should be listed on the screen. The other navigators throughout the state that you can contact if you live in Columbia or places like that. And if you're in the Charleston area, as well as I can go across the state as well, then you're more than welcome to give me a call and I can assist you.
Excellent. Yeah. And I've been scrolling as you were talking, your phone number, Linda. And of course, folks, go to healthcare.gov and we'll share in our comments the state navigators where you can look up that information because you can get enrolled, as Linda said, during the special enrollment period if you are qualified. Linda, unfortunately, we are at the end. We're at our time. We were running a little bit late.
Okay.
And what else to wrap up? What else do we need to know?
Well, what we all need to be aware of is this is tax season. And at St. James in the McClellanville site for individuals in Charleston and Berkeley County, we do have SC Thrive coming on March 4th to provide free tax assistance. And this year, the income has increased to $73,000. So if an individual is interested in seeing if they can come and have their taxes done, then you do need to give me a call because it will be next week, Friday, which is March the 4th. And we're looking at doing another tax clinic on March 25th. So as I mentioned, the first appointment is at 10 and the last is at 1 o'clock, and each appointment is for approximately 1 hour.
And what were those dates again for the tax information?
The first clinic is going to be March 4th. And it's going to be, the first appointment is for 10 o'clock and the last is for 1 p.m. And each appointment lasts at least 1 hour. And you do need to have an appointment. You can't walk in. So you don't have to be our patient to come, just long as you live in Charleston and Berkeley County at this time. So if anyone has any questions or concerns, then please feel free to give me a call. If they want to schedule an appointment, feel free to give me a call and I'll be happy. Right now, the schedule is open. However, it does fill up fast. The last thing I wanted to mention, Marilyn, is that as Dr. COVID mentioned, we are still doing the COVID vaccination as well as testing.
Mm-hmm.
And we give the Moderna.
Mm-hmm.
And we also do the booster as well. So if a person is interested in having that done, there are different locations that they can contact and find out when they're going to be doing either the testing or the vaccine and schedule a time. And our different location is North Santee, which is in Sandpit Community. That number is 843-527-7533. Georgetown is 422 Fraser Street. That number there is 843-436-1333. We also have a site in Choppy, and the number there is 843-545-8723. We also have a pediatric department in Georgetown Pediatric, which is on 57 Jasmine Avenue in Georgetown. Their number is 843-546-8686. And at the McClellanville site where I'm located, which is 1189 Tidwin Road, that number is 843-887-3274. And we have a site in Andrews at 675 North Morgan Avenue, Andrews, South Carolina. And that number is 843-264-2680. And we do also have an annex, as well as we have 3 school-based clinics. One is open, and that's at the Andrews School, and that's at 13072 County Line Road. Mm-hmm. That number is 843-264-5949. And the other 2 school-based schools or clinics that we're going to be opening soon is at the Andrews Middle School as well as the high school.
Excellent. Excellent.
Right. So if you have any questions, then please feel free to give me a call.
So there you have it. St. James Health and Wellness Community Outreach with Linda Lynah. You guys have a lot going on between the special enrollment help, the tax preparation season. March 4th is the first date. And then, of course, the different locations where you'll have to call, but if you need a vaccine or testing, they are still providing that. And that's the importance of community health centers.
Right.
Why we have them in our communities to provide those services regardless of income. And,
right.
And this is about public health, folks. This is about all of us helping each other to keep each other safe and healthy. Linda, thanks for coming on. As always,
appreciate you for having me.
March is Mental Health Month because we were going to talk about the public health theme.
Mm-hmm.
March is so big thing, and this is really important for me. Is mental health awareness, that's just a huge, especially in the Black community. And I think I saw just an article today. They already started talking about mental health awareness for African Americans.
Uh-huh.
And I believe Google has some information about that. If you just Google it. But mental health awareness, I want to just remind everyone that March is the month where we need to, they just raise awareness. You should always be cognizant of your mental health, especially the Black community. Black Americans, we African Americans, we have inherited generational trauma.
Right.
And many of us don't pay attention to that. So if the more that we can talk about it openly, I have suffered from depression off and on since college. So I talk about it so that others can feel comfortable talking about it too.
Mm-hmm.
Because we all need to just take a deep breath sometimes and wonder, why am I reacting this way? Why am I making the decisions I have? Just kind of, what are the symptoms so that I recognize why, this is happening to me. And it may be a mental health issue. We need to treat our mental health just as much as we treat our physical health.
Right.
And that's why we need to be open and talking about it. So when I saw that for March, mental health, they start recognizing that mid-March. So being a little technical there, but let's start having those open conversations about the mental health for all people, but in particular, African American, because
Right.
we have some generational trauma that we
Right.
need to deal with. And, it's part of, it's part of that health checkup that we all need to do.
Yeah, that's true.
Mm-hmm,
And especially now during this time with everything that's going on.
Yeah. With COVID and now the situation in Ukraine,
Exactly.
it may be far away, but many of us probably know or have a family member or neighbor or friend
Exactly.
in the military or part of the military. My dad was a veteran, so I'm always cognizant of our veterans. I have cousins who are veterans.
Yeah,
I have cousins who are active duty.
Yeah.
A family who active duty even as we speak.
Right.
And I just keep them in my prayers and keep all of us in our prayers. COVID and the impact is not just physical, but it's mental. I myself, I have sometimes mornings where I struggle to get out of bed. And I really do. And I am aware that's my mental health, that I have to do self-care and take care of myself and just be cognizant so I can just take care of myself. And we say this, folks, so that you are encouraged to take care of yourselves and take some time to just be aware of your circumstances so you could seek a healthy mental health journey.
That is true. And the other thing, Marilyn, in which they keep talking about, and it also affects you, is the fact that the price of gas is going to go up and the price of food is going to go up. And those are things that people are going to be concerned with because some people are not working. So it's a matter of, what do I do?
Yeah.
How do I survive?
Yeah. That's right.
Yeah.
And then we have the Great Resignation going on. And one of the reasons we have the Great Resignation going on, people are tired, stressed out, and at work, they're not going to put up with a lot of foolishness anymore from people who are causing them stress at work. So people are walking away. And honestly, if you have to walk away for your mental health, that's an option, folks. Just use your imagination to figure out how you're going to pay your bills or reach out to organizations and others that could just help you. If you just need a break for a month or 2 months and you could figure out a way to do it, go forth and do it. Because I'm telling you, in the long run, it's going to benefit you to just rest and rest that mind. Linda, it's always good to have you here. I'm always delighted to have Miss Florinne. So thank you for making that happen. And of course, Natasha also is excited to hear that she's a newlywed.
Yes.
And, always love to have you guys back on. And thank you for letting us know about tax preparation season. That's huge. The special enrollment information, and of course, the other programs at St. James Health and Wellness. Always good to see you, Linda. I know we're going to be talking and everything. Have a wonderful afternoon.
You too. And, like you say about the tax season, let people keep in mind that they want to go to a free tax so they get all their money instead of having to give some of their money away.
Exactly. Thank you very much. I appreciate it. Thank you for saying that. That's important. Y'all get every piece that you can get.
That's exactly right.
Every penny. That's your money. Go get it.
You earned it.
Yes, you did. You earned it. Thank you, Linda. Always good to see you. And thank you to our viewing audience for joining us today. Miss Florinne Linen, our special guest, Miss Linda Lynah, our co-host for Public Health Awareness every fourth Wednesday, and Miss Natasha, clinical pharmacist, for coming on and giving us the information, personal and professional information that we all need to know. I want to remind everybody that a gathering place is every Sunday and Wednesday at 4 p.m. And this Sunday's program, we're featuring Monica Upson, author of Give Mommy Dragon Some Space. I am looking forward to hearing some readings from this book and also the illustrations. This is just really kind of touching home. I am just always delighted to bring on our authors, our local authors who are making a difference and helping with literacy and just, helping educate our kids in a fun way. And y'all, if you could read, if you can write, you can do anything. And I am a huge, huge proponent of that. So y'all come on back this Sunday at 4 o'clock. Also, If you like live theater, the special offer for Gullah Geechee Chamber of Commerce, receive $10 tickets March 11th through 27th at the Dock Street Theater, the historic Dock Street Theater, which is the nation's oldest theater. Black Pearl Sings. Follow the journey of a woman and a song inspired by a collection of true stories. Black Pearl Sings tells the story of Pearl, a Gullah woman from the Sea Islands of South Carolina who finds herself in a Texas jail, separated from her daughter, and of the song that might be her ticket home. This is the struggle of cultural appropriation on a very personal level. Black Pearl Sings, with starring New York equity actor Kristen Gilmore as Pearl and resident professional actor Caitlin Krall as Susan. You can buy your ticket at Charleston Stage, charlestonstage.com, or call 843-577-7183. Y'all, they're going to come on the show. They're going to be here on March 16th, and actually it's going to be a pre-recorded show because March 16th, they actually have a program that evening, but we're going to pre-record a show to talk about Black Pearl Sings, and we want y'all to have those special tickets. So go to our Facebook page and get the information again, but I'm so excited about the opportunity, and yes, I'm going to get some tickets, y'all, and I'm going to be there because I love live theater. I love live performances, and it's about time that I did that soon. And of course, even though I'm going to see a live performance, because I don't want Miss Florinne to be mad at me, I am going to wear my mask, wash my hands, and socially distance. I see Miss Florinne in the back. She's still in the back, y'all, in the green space, nodding her head, because that's right. We can enjoy ourselves, but we just have to practice what we preach, wear those masks, get vaccinated. I'm boosted, and I'm going to get my ticket in and go enjoy Black Pearl Sings. Always, folks, I always enjoy having my viewing audience here. Just a reminder, every Wednesday and Sunday at 4 o'clock, you can join us on A Gathering Place. Looking forward to this Sunday with Miss Monica Upson, author of Give Mommy Dragons Some Space. Looking forward to that and enjoying it. All right, everyone, enjoy the rest of your day. This is Marilyn Hemingway, your host, and we will see you on Sunday. Good night.